she goes back.
Yeah, she's got it.
No,
Okay, you
Get
can't.
her
You
another
have to
side,
let go
but
of the
she's-
wall. There you go.
Jonathan Dale, mommy.
Okay.
that's maybe 153.
Okay.
She
Good.
gone.
Good.
Yeah, made this one.
She should be her regular weight is like 170, 165.
54. Good. Have a seat for me.
You got Jude? Yeah.
Oui, mommy, it was 154.
167. She's 160.
Yeah, she's usually, that's her regular weight is 165.
Usually happens when we're in the
This
hospital.
side, we trying. We trying with the shake and the.
Okay. You wanna go around to her lines? Thank you. Do you remember my name?
Yes.
What is it?
What's her name?
I know we both got it wrong the other day.
She can't see it.
No,
No.
m'te pensé c'était Maï tout, m'te trompé. We have the same mistake. I don't know why we both thought that. I don't know what it was.
Because her middle name is Maria.
Oh, that's what it was. I remember you saying that, and that's what stuck.
But no one ever calls me that. So it's like when you ask me in the middle, how I know?
That's what it was.
Because no one has ever called me by my middle name. That's like,
What's your middle name?
Maria, and I remember her saying that the other day, and I saw her in the house like Maria.
je m'appelle Luli. Luli.
Luli, that's a beautiful name.
Luli. It's short for Lourdes.
Lourdes, ooh,
We have a cousin named Lourdes.
yeah.
They gotta put the Maria because of the scent too. She put Maria in all our names.
My mom did too.
She speaks a little Spanish.
And the young lady behind you, her name is Damaris.
Hello.
My name is Raphael. Are you taking pictures?
Yeah, take pictures of her.
No, the doctor of her. No, they're gonna do. We're calling our sister the next practitioner.
To do a conference call. Are you calling Monokiv now?
Okay.
Okay.
My name is Raphael. I work with Dr. Portalance, who's the one taking care of you, okay? How are you feeling today?
Hi, Mama. Hi, Uncle E. This is Jonathan.
Yes.
I'm
Come on,
doing good.
Weak.
Um,
Weakness.
Nothing much. We're here with the doctor with Monica.
And
I'm gonna put
Granddaughter.
granddaughter,
Grandson.
grandson.
Niece.
Again, no, you're part of my team. This is pretty awesome. So we got pretty much the team here. Hi, Uncle.
Hi, Monokiv. That's the doctor. Dr. Raphael.
Okay, so we're treating your brain right now with radiation. I think if I'm right, you got treated Thursday, Friday, and then Tuesday, Wednesday. So today was your fourth treatment.
She has 6
And we're
more.
going to go through a total of 10 treatments. So that means you're going to finish your treatments on, we're going to count it out. We got Thursday, Friday, and then next week, Thursday is going to be your last treatment, the brain radiation. Are you still taking those steroids? Dexamethasone?
No, she's not taking the
Not taking any dexamethasone. Okay, good. Fine with that. And tomorrow you have an appointment with the medical oncologist. Dr. Ike is what I call him. But no one can say my last name either, which is Yechieli. So I just go by Raphael. Got it? Okay. Start asking questions, please.
Monokiv.
My wife and the doctors were asking about prognosis after the radiation. What to expect?
That is an excellent question. So this is a new journey for you guys, which I understand, which is not easy to take on new journeys, especially when you weren't expecting it.
Yeah.
The goal is that each step of the way, what we want to make sure is everything we're doing is what we're doing is something is for you, not just doing things to you. And what that means is that, and this is the question that should be asked at every step of the way. Okay, what you're offering, is this going to help me live longer and or better? Hopefully both, longer and better, correct?
Okay.
But at least one of them.
Okay.
And if you're not convinced that someone's going to be doing something that's going to help you live longer or better, and you don't want to do it, don't do it. Because our goal is to help you live longer and better. Good? So, we know that the treatment we're doing right now is the radiation to the brain. Anytime cancer can go to the brain, anytime cancer started in the lung, we know that, and it's in the brain now. It's really important we treat with radiation because chemotherapy doesn't get into the brain well. So let me take a step back and explain a little more. There are three main treatments for cancer. Three main treatments. One of them is surgery, where we go and cut out the cancer. Okay? The other one is radiation, where we aim our beam at an area where we know cancer cells are. Both surgery and radiation are what we call local treatments. It means either what we're cutting out or what we're aiming at. The brain, we know there are microscopic cancer cells throughout the brain, even though there's what we see, but we know there's other spots that we can't see. And treating the whole brain with radiation, like what Dr. Portland's, my partner, is doing, is very appropriate. And we know that that type of treatment, 10 of those treatments, will help you live longer and live better. So even though we went through this potential side effects, overall we know that treating it is much better than not treating it. But that's just one part of the journey. The next part of the journey that you're going to be learning about, and I suggest you all come to because it's going to be an important appointment, or you don't all have to come, appoint one of you to be the point person to ask questions. Okay, that would be you. So that's very important that you know that all the questions that come up at any step come to you, and then it's clear that you'll be communicating, let's say, with me or tomorrow with Dr. Ike.
Okay.
The next most important thing for your care to help you live longer and better is going to be chemotherapy, because that's the third part of how we treat cancer. And the thing with chemotherapy is it either goes in by IV into the bloodstream, or there are new chemotherapies sometimes that are by mouth, take it by mouth, and it's a pill, and it goes into the stomach, and it gets absorbed into the bloodstream. And then where does it go?
To the cancer.
Everywhere. And the reason why that's important is because we know the cancer started in the lung, but it spread. And that means it knows how to hit the 95, and the 595, and the Florida Turnpike. And what that means is we need to be able to fight those cancer cells anywhere they might be. And the only way to do that is with chemotherapy. And that's why chemotherapy is going to be the most important next step in dealing with the cancer. The times when radiation might be important as well, I think it's important to know that, is like we said, the brain, we're doing that. But if it ever, sometimes cancer can go to the bone. And if it goes to the bone, it can cause pain. Or sometimes it can just cause a local problem somewhere, even in the lung. Start bleeding. That causes problems. And then sometimes we'll turn around and treat just that area. But overall, the most important thing to help you live longer and better is going to be the chemotherapy, which you'll talk about tomorrow. He won't start it right away, probably, but he'll be the one explaining all that to you tomorrow. Okay? And that's it. So we'll finish in general, a lot of times what happens is we finish the first phase of the radiation, the brain, the 10 treatments, and then off into the chemotherapy side of things. Ultimately, all of this is to help you live longer and better. You asked about prognosis. It's a good question. We don't know how long someone's going to live. I can't, if you want me to predict that about any one of us in the room, including me, I can't and won't. And our crystal ball at Sylvester is very cloudy. So we can't predict things. But sometimes that allows us to see clearly and allows us to say what's best for you to help you live longer and better. So, the phase that we're going through right now, the radiation to the whole brain, I think it's working really well and you're tolerating it really well. Let's keep going. And then, the chemotherapy discussion I want you to have tomorrow. Make sense?
Yes.
I'm gonna ask my aunt because
Is that helpful?
she gave me. I don't know if she.
You need to
What
know
about
what
the
it is.
function of
Okay.
the
She's taking tomorrow.
Okay, I will.
Functional status.
Okay.
So that's something that, again, so explain, ask your question a little more. What are you asking?
Is she able to ambulate without any assistance? She can do daily activities without any cognitive
Time will tell. I don't have an answer for that right now. Hopefully, as things go on and as treatments kick in, she'll feel better and better and better. Like we said, our goal is to help you live longer and better. And the better part is exactly like you said. Ultimately, I will say, in general, people don't, it's, the starting the journey of cancer might never get back to the way it was. But that doesn't mean we can't live great going forward. It's just a new set of challenges. So, Will she be able to walk the way she did, run the way she did? I don't know the answer. Time will tell.
Okay.
Je,
I believe this
je me confie dans la main du médecin.
I was just curious.
La seule chose,
In your experience, what you have seen, you know. So, but that's I perfectly agree with the answer.
Thank you.
Okay. So with that, I believe I am very impressed with your discussion, and we'll go from there.
That's right. So let's keep going with the treatment. You'll be seeing Dr. Portalins next Wednesday, okay? And the medical oncologist I want you to go to tomorrow and sit and talk to him as well, okay?
ils vont me bailler.
Non, pas jeudi, hein, mamie, demain. Pas jeudi, hein, demain, on va voir l'autre docteur, l'infini mercredi prochain, on va voir l'autre docteur.
Allez, viens.
Since you started the radiation
C'est son seul
treatment,
problème, moi, il y a un bacalao.
She says she can't sleep.
is she weaker or
She
stronger?
sleeps during the day, weaker.
Weaker, getting weaker?
Mm-hmm.
She's complaining of vision on the left side.
No steroids at all?
She gave me the list of the 3 medications she's at, and she doesn't have everything with her, but they're saying that no, there's no Decadron.
Okay, so we're gonna put you back on this medication called steroids, because sometimes the tumor causes inflammation, and the radiation can cause inflammation, and steroids decreases that inflammation, and that can help, you know, maybe with the vision, maybe with some of the weakness. On the other hand, it could also make you less tired, so that's not so good. So I'm gonna want you to take, we'll probably start with 8 milligrams, okay? So I want you to take 2 pills a day, one in the morning and one in the early afternoon.
Okay. I'll have your list for tomorrow, because I know she takes a blood pressure pill in the morning. I'll bring you the full list tomorrow.
She hasn't had any seizures.
No, she hasn't had any seizures since she was
She's supposed to
admitted.
be taking anti-seizure medication, so we need to know
Okay.
ASAP if she's on it or not.
Is that the little green pill?
I don't know what
Okay,
color they
I'll.
are.
It's called Capra, though. is
Yeah.
the
She's
name
on
of it.
Capra.
Yeah.
So that's important. That's
Yeah.
one of the most important ones that she needs to be taking if she's
Yeah,
had
she's
seizures.
on Capra.
Okay.
Je vais faire confiance.
Okay, Sandy, thank you very much.
Thank you.
Thank you, doctors.
Take care.
Okay, have a good day. Bye-bye.
Okay. Speak to me a little bit. Your flashlight is on.
Oh, sorry.
Is there any way to turn that off?
Yeah. Turn that off now.
Thanks.
Regarde, ne va pas rien. Il y a confiance dans lui.
If my phone would cooperate.
She's not afraid. She trusts that you guys will do what you guys do.
Any other questions?
Aucune autre question,
Tu
maman?
auras des questions, maman?
Et puis bon, je me confie dans la bonté de Dieu. avec lui.
Question,
Question, maman.
Sans seule question, l'année de
She's a fighter. She just
Family.
gave up.